Hi there, welcome to this week's tip of the week. I'm Dr. Megan Von Holtz. In the last couple days I've probably seen about a dozen kids ages 2 up to 17, and I got to thinking that's probably a really good topic because I've had people ask me point blank before, why on earth would a child need to see a chiropractor? So I thought let's talk through that. First thing, let's talk about some of the reasons why parents bring their children. Really little ones, sometimes, a lot of times it's like chronic ear infections, or they're colicky, or maybe mom notices that when she's nursing the baby really prefers one side over the other, or when the baby's sitting in their seat maybe they're preferentially looking one side as opposed to the other. So those are signs that we need to make sure that their neck and their jaw are aligned properly. As they get older and start to learn to walk, sometimes people will come in noticing maybe the little kid's foot turns out or their hip turns out. Sometimes they'll have headaches or sinus allergy type issues. And then as the kids get even older, do more activities, then we start to notice more ligament and tendon type injuries or even some pain. Really, there's a lot of different things, and even sometimes before the baby joins us, we have obstetricians and midwives who refer patients to us, pregnant women whose babies are breech. And the idea with that is sometimes if there is misalignment in the pelvis, it causes interuterine constraint. So if we can align the pelvis correctly, sometimes it leaves enough room in that cavity that the baby will turn on its own and makes delivery much easier. So those are all actual physical reasons why someone might bring a child in, but sometimes I have parents and guardians bring kids in that have absolutely no outward signs. And the idea of that is, if you think about it, health is not really the absence of pain or a symptom. It's really all organ systems, every single thing functioning at 100%. That is what makes you 100% healthy. Another thing that goes with that, OSHA, it was several years back. OSHA is the Occupational Safe and Healthy Health Administration. They did some research and put out a statement that said at age 10, the average 10-year-old, they thought they had about 10,000 micro traumas happen to them. So not major traumas, but little traumas that add up over time. I mean, 10,000, that's a ton. And if you think about it, really, really healthy kids, say they can fix 99% of what happens to them, 10,000 microtraumas, that still leaves 100 that the body can't fix. So what happens to those microtraumas over time, especially as they hit their teenage growth spurt, or they get into their 20s, 30s, and 40s? Some of those things are chronic conditions that we're feeling now. So if we can identify them in a child and actually try to correct them when the body can't, sometimes it will actually eliminate some of those chronic issues. And you know you've heard of some of them. I mean, if I had a nickel for every 65-year-old male who told me, oh, don't worry about that right knee, I injured it in football and it's never been quite right. Think about that. How many times do kids fall when they're learning to walk, learning to ride a bike? I mean, I wasn't a particularly active kid, but I still rode my bike into a tree and did a flip off my bed and broke a collarbone and ran into a soccer goal and gave myself a concussion. So stuff happens. If we can clear these things out, identify them, fix them, it can make a really big difference. And one of the most wonderful things with kids is they heal so fast. So what might take me 20 times to fix an adult could take 3 times in a child. And the other really fun thing, especially with really little ones, is, you can't really fake it. If someone brings me a colicky baby who hasn't slept in a week, so mom hasn't slept in a week, dad hasn't slept in a week, and no one is particularly happy or has much patience, if we can find a misalignment at the top of the neck and just even use my pinky finger to help align that, and then the baby sleeps for 14 hours, you can't fake that, and you make a whole family a whole lot happier. So there's a lot of different things that can happen musculoskeletally. If you have any children that might be experiencing some of these and you'd like us to look at them, or if you just have questions, it's something I always love to talk about, just give us a call. I'm Dr. Megan Von Holtz with the topic of the week. We'll see you again next time.